Hello, welcome to the latest episode of Journey to Life with me, ArletteJones-Lawson, and my daughter and co-host, Constance Field, who I would like to congratulate for graduating with her master's degree in clinical mental health counseling from the Chicago School of Professional Psychology. She is now a licensed associate professional counselor, and we are so proud.
Well, thank you. I appreciate it.
Our topic today is suicide prevention, and September is National Suicide Prevention Month. We are honored today with our special guest, Nicole Dempsey. Nicole is a licensed clinical social worker, and in her current role, she is also a suicide prevention coordinator. Nicole graduated with her master's degree in social work from the University of Texas at Austin in 2011. Nicole's previous experience includes family and youth in-home service, substance abuse, and private practice. She has a passion for combating suicide by using research and best practices to help increase awareness in the communities around suicide prevention. Welcome, Nicole.
Thank you. Thank you for having me here. I'm very honored to be on this podcast with you both today to share this really important information about suicide prevention. So like you mentioned, it is Suicide Prevention Month. Not that we don't need to think about suicide prevention all year round, but it's a great opportunity to just share some helpful tips on how to identify if someone's at risk for suicide, and then how to get them connected with help. Because I think a big misconception is that, it has to be a mental health provider that does that. And it doesn't have to be. It can be any one of us who can learn what to look for, what the signs are, and then how to help get that person connected. And so one other thing I wanted to mention real quickly, though, is that this can be a very sensitive topic. So if for some reason, if you feel your distress level going up while we're doing this podcast and we're having this conversation, please take care of yourself and place this on pause and just come back to it if you need to. You can always call the National Suicide Prevention Lifeline at 988 to talk to someone who's a trained responder that can listen and just kind of help get you through that period of time. And then I also encourage you to reach out to a mental health provider and get connected with someone that you can talk to on a regular basis. So, but again, thank you for having me today.
Yeah, Nicole, we're so grateful for you being here. And I'm really thankful that you made that PSA that you just did, because it's so important. This is such a heavy topic, but such an important topic, and it can be triggering for people. So I am thankful for you making that announcement. Speaking of the population that we have, there's different segments of our population that suicide can affect. Can you speak a little bit to the effects on different populations, different groups?
So yes, the most recent data we have shows that in 2020, approximately 46,000 people died by suicide, and that's for all age groups. And so that makes that actually the 12th leading cause of death. However, when we look at the different subsets of our population, there are some differences in the rates. For example, it's the 12th leading cause of death for people who are the ages 20 to 34. It's also the 4th leading cause of death for people who are at the ages of 35 to 44. And then also to note that over 1/3 of those 46,000 people who died by suicide were over the age of 55. We also, though, know that the highest rate of suicide is for people who are 85 years and older. Mm. So another important thing to mention, too, is that the gender differences, such as males are at a 4 times higher rate of suicide than females, although they only make up approximately 50% of the population. So again, the rate for male suicides is higher than for females by a lot.
Wow. Have you noticed any differences in the suicide rate as it pertains to the different ethnic groups?
So yes, there are some differences amongst the different racial and ethnic groups. So when we're looking at the data from 2020, we do see that the highest rate of suicide is among non-Hispanic American Indians and Alaskan Natives. And then secondly comes in the non-Hispanic whites. But you'll see on this slide the differences amongst the different ethnic and ethnic groups as well.
Yeah, it's so interesting. And, you know, I was thinking about COVID and how that being introduced into our society has increased a lot of different things. Have you noticed an overall trend in suicide rates as it's related to COVID?
So interestingly enough, when COVID first came on in 2020, a lot of people were really concerned because of the fact that COVID had so many of the things associated with it that place us at higher risk. So for example, you know, being isolated, financial issues, chronic medical health issues, and so forth, that do increase your risk for suicide. So the thought then was that we're going to see our suicide rates skyrocket. However, what's been noted is that it's actually, we haven't seen that reflected in the most recent data from 2020. We do know, though, that the rate of suicide has been shown to go up beginning around 2000 steadily over the years. From 2000 to about 2018, we did see an increase every year. And then from 2018 to 2020, we saw the rates come down. And then the most recent preliminary data that hasn't been technically released yet, but what's been showing the trends is that the rate did not go back up drastically from 2020 on. And so this is really helpful news. I should say hopeful news that there's something different that's happening that's not causing the rate of suicide to go up anymore for the overall population, I should say. And that the preliminary data shows that it didn't go up again after 2020, although we had COVID, which caused a lot of the things like I mentioned earlier, risk factors, and a lot of distress for the nation, you know, and world together. And so that's to note. However, we need to remain vigilant because although the overall rate of suicide for all populations did go down and didn't show it going back up after 2020, it did go up when we look at smaller subsets of the population, such as Hispanics and African American. So those minority groups and younger people, that subset of the population, those groups did continue to go up after 2018 and may have been impacted more by COVID after 2020 than when we look at the overall population.
That's interesting too, because you know, I know that for the younger population, the isolation and all of that from COVID, I mean, it was already an issue with minority groups who are in the LGBTQIA+ community having to deal with suicide rates in younger children and children basically, and teenagers. But bringing in COVID, it just seemed like all I was hearing was an uptick in that. So that's interesting that you pointed that out.
Well, one thing too to notice is that when I'm talking about the suicides rates didn't go incredibly, you know, didn't skyrocket like we would have assumed, at least for now, right? We don't know what could happen. There's always the after effects. That's something we could see down the road effects, because obviously COVID is still affecting us still to this day, even though we're not in the middle of an epidemic, you know, at home, not seeing anyone anymore. But people reported more increase in anxiety and depression. So although the rates of suicide didn't seem to go up, the rate of depression and anxiety has. And I saw a statistic recently, I said about 25% increase in people reporting suicide and depression after COVID.
I guess people in isolation and you know, and social media being one of the primary ways that people communicate. You know, I know a lot of church-going women, even elderly women. I know my mother-in-law's, you know, their church service went strictly online. And, you know, and so the whole Facebook world, you know, opened up to them. And so I'm wondering if, you know, people reaching out to mental health professionals, you know, became more acceptable and people reached out more. And if that may be part of why why it seems like the suicide rate maybe didn't like skyrocket like you would expect it would when people are you know, in isolation.
Yeah, I think it's a very good point. And I'm sure there's going to be a lot of studies done around it to see why that is. And it's interesting. But yeah, I think it did encourage people to reach out to each other more. And this is just my thoughts on it. But also more access to virtual options for therapy versus, you know, we didn't do that as prevalently before COVID. And now it's been more of an easier thing to access. And so that allows more people to have access to mental health therapy. But yeah, it is very interesting.
And TikTok too. I mean, there's a lot of therapists on TikTok. There are, you know, I think it has to do with generational things too, like Gen Z, they're very open. Millennials are very open to talking about their mental health and, you know, not being so shut in when it comes to expressing what's going on in their lives. So there's a lot of bravery around that. But I did want to ask you, I know on one of your slides, you talked about methods used. Is there a common method that you see, or is it based on different populations?
So it looks like overall, when we're looking at the general population, by far the method that's used the most to die by suicide is firearms. And I don't really know the data right now off the top of my head for different subsets of the population, but I know that that's over 50% of deaths by suicide for everybody is by firearms.
So now suicide has become so pervasive in our country, it almost seems like it's lately become an epidemic proportion. And I know that there's a term that was recently introduced to me, suicide contagion, and I've never heard that before. Can you speak to what that means and what that is?
So yes, so what we know about suicide contagion is that it's a real thing that has been supported a lot through a lot of evidence out there, that if a suicide or suicidal behaviors occur, that we do see an increase in suicide or suicide behaviors. So I mean, that can, you know, obviously differentiate based on who is the person who died by suicide. So say, for example, it was a celebrity or a well-known person, and it's talked about in the media a lot. There's been evidence that immediately following that there's been an increase in suicide rates overall. Or, for example, if a student in a high school dies by suicide, that it's been noted that the rate of suicide or suicidal behaviors in that same high school will go up. So it does seem to affect those who might be already at risk for suicide. It does increase their risk for suicide when a suicide or suicidal behavior occurs. So things we can do, though, to help offset that suicide contagion and to be conscientious of it is to make sure that we have responsible reporting. So media really needs to be aware that they're not, that they're just reporting the facts, and that, they don't go into overly discussing the details of the incident, of how it occurred, or particularly the method, because it does seem to be something related with the method will also be something that you'll see an increase as well. Or using sensationalized titles to the articles that they write. So instead of doing so, focusing more on just the facts, and then also focusing more on resilience and those people left behind by that suicide. Or also, making sure that they're putting resources and including resources in the articles that state, how someone can get connected with mental health support. And, making that the focus more so than just overly reporting about the person and how they died and so forth. And also, but just even if it's somebody in high school, making sure that there's a lot of supports in place to follow up with those individuals that had direct contact with that person or knew that person, that they're getting a lot of extra support immediately following a suicide, and people are checking in with them and seeing how they're doing. So those are really important things that we can do to help, combat that suicide contagion thing you're discussing.
So I love that you talked about the impact of responsible reporting, because it's so important. I know that the verbiage is starting to change a bit, with trying to break down the stigma of this topic and the stigma of talking about mental health and suicide ideation. What would be a responsible way for someone to, address the verbiage of suicide when someone dies in that manner?
So along with responsible reporting, there are ways that we can also talk about suicide responsibly amongst each other. And the best way to say it is to say that someone died by suicide. Because when we use such as completed or
committed or something like
Yes, thank you. That that again goes back to committed is saying when it goes back to where it was considered like a crime. So again, to really be sensitive to the fact that someone who died by suicide, that they were in intense emotional agony in order to die by suicide. The best way we can say it is, somebody who died by suicide.
So thank you so much for sharing all of that. What do you think are some risk factors when we talk about suicide?
So research has shown that there's some things that they've found to that increased risk for suicide. And there are many. I'm just going to note some of them here. And obviously someone can have some of these risk factors, but yet not have thoughts of suicide. So these are just things that have been correlated with increased risk, don't necessarily cause someone to have thoughts of suicide. And those things are if they've had a previous suicide attempt, if they have a history of depression or other mental health illness, such as substance abuse disorder, serious illnesses such as chronic pain, criminal or legal problems, job financial problems or loss of their job, impulsive or aggressive tendencies, if they're misusing substances, if they have, again, a sense of hopelessness, don't really see things getting any better, can't really see the light at the end of the tunnel. If there's a family history of suicide as well, if they've had some kind of loss, like the loss of a relationship, or maybe the loss of somebody who they know who's died, so the death of someone close to them, conflict that they have in a relationship, social isolation, bullying. Bullying is a big one that we see, especially with the younger youth, and having access to firearms, and then exposed to trauma or a suicide as well.
So Nicole, what are some protective factors that we can keep in mind?
Yeah, so on the other side of that coin, where I just talked about those risk factors, there are things that have been identified that also are ways that things people have that we call protective factors, things that they might, that decrease their risk for suicide. And that's if someone has effective coping and problem solving skills. If they feel they have reasons for living, if they have family, significant others, friends, pets, that they feel like it's worth living for those people or pets. Strong sense of cultural identity, supportive network, feeling connected to others, feeling like they belong and have a place in amongst their social network or amongst society. Feeling connected again to school, community, and other social institutions. Having availability of consistent, and not only consistent, but also the quality physical and behavioral health care. And reducing their access to lethal means can also be a protective factor as well.
Thanks for explaining that, because that used to confuse me. Whenever I would assess somebody, I'd be like, protective factors, okay, risk factors, okay, so just having that explained is very, very helpful.
And something to also note with that too is that a lot of these things, when we're looking at risk protective factors, the goal is we can minimize risk at the same time while we increase protective factors. However, some of those things aren't necessarily things that you can change. Some of these things are things you can impact, such as, getting connected with family and friends. That's something we can make a difference with. However, some of these risk factors are things like having a history of suicide in their family or a previous suicide attempt. Those aren't things we cannot necessarily change. So that's just another little thing to remember, is when you're looking at these, some of these are things that can be impacted and some not as much.
That makes sense. Yeah, for sure. What are some safety measures that can be taken to prevent suicide? You mentioned some of them, like, mitigating the access to firearms. I think you said something about having access to mental health care. But are there others?
So I know we talk a lot about lethal means safety around firearms and reducing someone's risk for access to a firearm. However, when I say lethal means safety, we're also just talking about in general reducing someone's access to a lethal means that they could use. So that could be firearms, that could be a large amount of medication, so forth. And so what that is let's put some more time and distance between that person and the means that they could use to die by suicide. And so that might seem oversimplified. However, research has shown that to be very much supported, that it's an effective strategy for reducing someone's risk. And for 3 big reasons is, number one, when someone's experiencing a suicidal crisis. So let's say that they've been having thoughts of suicide for a very long period of time. However, they go from having the thoughts to then having a specific plan and then deciding that they're going to act on that plan and actually taking that action. And that period of time that they go from, and we call that the acute crisis time period, can be very short term in nature and usually centered around a crisis. So say, for example, someone, a relationship ends, that they have a big breakup. That would be like a crisis that might push them over the edge. And what we do see is, though, that research has shown that that period of crisis is short term in nature, meaning most times an hour or less. Secondly, people do not typically go on to substitute a method that they have in mind to use that quickly. So if they have a thought that they're going to actually use, say, for example, firearm, but they don't have access to that firearm during that period of time, that's not very likely that they're going to try to find something else to use during that period of time. And then lastly, when we look at people who have attempted to die by suicide but have not, that the majority of them, actually research shows 9 out of 10 of those consistently do not go on to die by suicide later on in life. So when we look at all those things combined, we can see that if we can help someone, we can make it so it's difficult for someone to access a lethal means during that short period of time and help them get on the other side of that short acute crisis to the point where maybe they can then be able to use a coping skill, or maybe they can then call someone, or someone's able to intercede and talk to them and connect with them, that we can really go towards a long way towards reducing that risk of suicide for them and saving a life.
That makes a lot of sense. I know that in like in Japan, and I'm wondering if this is what you're referencing with that hour space, but I know like in Japan, there's like this forest that's dubbed the suicide forest, and they have all of these like signs that go through a section of the forest that's like telling the person, whoever's in crisis, please don't do this, call someone, here are ways that you can help, things like that. And I know that the Golden Gate Bridge has something like that too. So are those ways that we can double down on, these, for lack of a better word, safety measures?
Mm-hmm. Definitely. Yeah, those are ways that we can be in that, we can put something in that moment of crisis that can maybe have the opportunity to just make them think twice, right? And to realize, maybe, call this number, call 988, and you can talk to someone in this moment. Because what we've been saying is that during that period of time, it is short in nature usually. And so there are lots of things we can do to help someone. And another thing, for example, is safety planning. Some people have safety plans that they can complete with somebody or they can get somebody's assistance to complete, or just complete on their own self. But it's identifying what are the things that are helpful for me that help decrease my stress level in that moment when I'm upset, and having that somewhere visible so that they can look at it, or who can I contact when I'm feeling upset. And sometimes when they're in that period of time, though, the stress level is so high, that they might not be thinking so clearly enough to be able to access those coping skills. So that's why that messaging is really important, or at least making it so that it's not so easy for them to access that means that they plan to use to die by suicide during that period of time. Because that could really help prevent them from actually acting on it in that period of time.
So Nicole, so what are things that we can do to help someone that we feel may be at risk of suicide?
So there's a couple of things that I'd like to talk about. So kind of piggybacking on the conversation we had about lethal means safety. The reason why we go a lot to firearms is because, like I said, firearms are the most lethal means of suicide. So important things we can do is, if we know someone's at risk for suicide, if they're going through a difficult time, how, having a conversation with them, would you be willing to potentially remove your firearm from your home, and get, keep it with a friend or family member that's allowed to have firearms? Or there's options also with like a local police department, or some storage facilities allow people to keep firearms there. If someone's not willing to do that, then, having conversation, what some small things we can do to, make it not so easy to access. So removing the ammunition, storing the ammunition separately from the firearm, placing that firearm in a lockbox, placing a gun lock on that firearm and letting someone else hold on to that key, or someone else know the combination to the safe of a firearm. So that increases in that time and distance. But along with that, if it's something to do with, you also want to make sure that they don't have a stockpile of medications as well, which is another way that people might attempt suicide, is by overdosing on medications. So making sure that people just have what kind of medications they need on hand. I know a lot of times pharmacies will have opportunities for people to drop off extra medication that they might have that they don't need anymore, to have it disposed of safely. So those are some things that we can do to help that person that we know is at risk. But again, going back to what you're saying though, is how do we take this information and identify if someone's at risk, right? Where do we start? And the way that we can do that is there's this very helpful acronym called SAVE that helps us kind of go through all the different steps of how we could potentially identify if someone's at risk for suicide, and then how to then get them connected with help. And so SAVE is, S stands for noticing the signs, A is asking that question, V is validating, and then E is encouraging and expediting them help when needed.
So what are some of the warning signs that we need to look for?
All right, so signs that we can look for are if they are expressing hopelessness. So feeling like there's no way out of the situation that they're in, that there's no light at the end of the tunnel, that things will never get any better. If you notice an increase in anxiety or agitation, maybe they're not sleeping as much anymore, or maybe sleeping too much. If you're noticing some drastic mood swings, so changes in their moods very quickly, talking about being a burden, feeling like they're just being a burden on others, and that the world would be better off without them. Experiencing rage or anger, engaging in risky activities without thinking, so just not taking a lot of care for themselves. So maybe driving recklessly or putting themselves into very dangerous situations. So, getting into physical fights with others. An increase in their alcohol or drug use. A big one is withdrawing from friends and family. So not really engaging anymore like they used to, maybe not picking up the phone, talking with people like they used to, not coming to certain events that you would expect them to be at. And then looking for ways to access means, or talking about suicide. So if they're looking for, like I mentioned before, trying to access a firearm or get more medication, stockpiling medicines, that would be another sign to be aware of.
I've also kind of heard that a lot of people that are that have like made a decision that they're gonna commit, or they're going to make that choice, have like their mood changes. They become like super happy, and they seem like they're, you know, they're no longer depressed. They're like they're like on an upswing, and people are thinking, oh, they're better, you know, right before they die by suicide. And so it can be kind of hard to see that as a warning sign, you know, because they seem like they don't fit in any of the categories that you spoke of, because they've changed. They're near the end.
Yeah, yeah.
Is that
And
like a particular warning sign as well?
yeah, you know, I've heard that too, and I don't really know enough about it to speak to it too much. I don't know enough about the evidence that might support that. However, I think one of the things to remember though is, like you mentioned, let's say they're having a lot of these signs we're seeing here, such as negative mood, and then suddenly there's a big shift in their mood, and it's all of a sudden very positive, and it just kind of incongruent, you know. I think you just got to listen to that gut feeling of, you know, they've been having all these other signs, that the ones like on the slide, but then all of a sudden today they just seem 100% better, and there's been this complete 180 shift in how they're doing. And I think that would be a time where you could say, okay, this just doesn't add up. You know, people don't just start feeling better that quickly.
I know that it's a really uncomfortable thing to talk about with someone that you know, if you suspect that, or you think that they're contemplating suicide. You know, when I was in school, they taught us that you don't beat around the bush about it. You just ask directly. You don't use, you know, baby terms. You just come out with it. And so I'm curious, what is the best way to approach someone and word it correctly, who you may suspect or think may be contemplating suicide?
Yes, I think you're very right, Constance. There's a hesitancy. It feels awkward sometimes to talk about suicide, because there's still such a stigma associated with suicide. And there's also this misconception that if I ask someone if they're having thoughts of suicide, that I might be putting that thought into their head, right? But again and again, research has shown that not to be true, that, like what you were saying, it's better to go ahead and come out and ask someone directly about if they're having thoughts of suicide. And so that is goes into the A of the SAVE acronym, which is ask the question, which is the next step. After you've identified these signs, ask them, are you thinking about suicide? Are you thinking about killing yourself? And that might feel very awkward, understandably. And so, but just, you know, trying to put that discomfort for yourself aside for that moment, and just realizing the importance of it, and just saying it in a calm, supportive manner. And one way I like to frame it sometimes, so it doesn't feel so out of the blue, as you could say, like, gosh, you know, I've noticed that you've been not coming, you know, to our house like you usually do, or you're not answering the phone, or I've noticed that you've been, you know, acting more agitated recently. You know, I'm worried about you. Are you having thoughts of killing yourself? So then at least you're kind of having a lead into that conversation with them. But I can't stress enough, though, the importance of saying it if you have any kind of inkling when someone is displaying the signs we talked about. Because when they've talked to people who had thoughts of suicide, if someone asks them, it actually has been shown to decrease their distress rather than increasing distress, because people have this sense of like, this calmness of like, okay, finally this relief, I can actually, maybe be able to speak about this openly now. It gives me that permission. And then if they're not having thoughts of suicide, it has not been shown to increase distress. So it's just important to know that. Just best thing is just say it. Just ask them point blank, like you just said. Don't ask, are you thinking of harming yourself? Because that can also be misconstrued into meaning something else.
Yeah, and a little transparency as a mom in this new age of I don't know what to call it, other than it seems like teenagers and preteens, their mental health is more fragile than, say, like in the 50s or something. I don't know how to if it's social media, I don't know, but I find myself at times getting really worried about suicide. And so I have in the past found myself talking to my kids directly and being so scared to, being so like, I don't really want to ask this, because partly being afraid of what the answer could be, but the other part being, actually crossing that hurdle of having a serious conversation with your child. I'm sure so many parents deal with that, or parent figures may deal with that, but it's important. And I do want to say that I believe that it's important to not believe that your child is trying to do something or having these thoughts for attention, because a lot of family members think, oh, they're just behaving that way because they want attention. No, no, so thank you for saying all of that and the importance of being direct about it. So what if somebody, oh, do you want to say something? I'm sorry.
No, I was saying exactly, and helping your child to know the seriousness of it and how seriously you take it.
Yeah.
And and if they do say something that indicates that that is a thought that's in their mind, or something that they're contemplating, that that you are taking it seriously, and that you're actively going to get them help with it, and that there's not a negative connotation around it, that there's not, you're not going to negatively think about them in some way that makes you think that they're weak or fragile.
So also the V stands for validate. And that is hugely important, I think, when we're talking about suicide prevention, because if you ask them if they're having thoughts of suicide and they say that they are, then the most important thing to do is to listen and let them do the talking, and just be there to be supportive. And you can say things to them like, gosh, anybody that's going through something like this right now would probably be having very similar thoughts like you are right now, or feelings like you are. This is a lot for anybody. There is help available, and we can get you connected with help. And I'm here. And it's not the time to pass judgment. And I think that's so important, is that we might feel compelled to argue with them. Gosh, you got so much going for you.
Yeah.
I can't believe that you would, even be thinking about taking your life. And that is not helpful for that person in that moment. It's really important that we're just there and present for them and listening to what they're trying to say. And although we might be feeling a lot of anxiety inside ourselves having this conversation, just trying again to at least appear calm to them, because that'll help them stay calm as well. And even if it's something that goes against your spiritual beliefs, not the time to try to express to them how it could be a sin. You know, this is not your time to impose your beliefs on them either. So again, just the validation part is so huge to help make that person feel comfortable to continue to talk to you, and then hopefully encourage them to make that next step to get connected with help.
Yes.
And E is to encourage and then expedite getting help if needed. So again, encouraging them to get connected with help. And that could be, you know, can we get you connected with a mental health therapist? Or if they already have a mental health therapist, I want you to talk to this person to help them understand, you know, what you're going through. If you haven't already told them, we need to contact them immediately and let them know. You know, offering to go with them to the emergency room for further evaluation. And also I think the most important thing again is calling 988 with that person is probably just a surefire way of making sure that you can get that connection with somebody who can better further assess that person in the moment. So again, you know, encouraging that person to call 988, being there to talk with them so that they can talk to that trained responder who can then talk to them and kind of get a better feel for what's going on, and then, you know, make referrals to resources or help them get connected with immediate help if needed. So that 988 is that National Suicide Prevention Lifeline. And it was at one time a 1-800 number, which is still going to be active for the foreseeable future. That has not gone away. However, the 988 is just a quick 3-digit number now that you can use to reach that same 1-800-273-8255 number. And so when you reach that number, it's open 24 hours a day, 7 days a week. You'll be able to speak to a trained responder who can then help to you know, talk more to that person, or can even be available to you if you're concerned about someone and want to call and talk to them about that person. Another option is that you can text the number 988, and that way you can also, you know, use the text option, or you can use a chat option, which is also posted in that slide with the link.
What are some of the warning signs if suicide is imminent?
So what we want to look for is, say, if the person is telling you that they are having thoughts of suicide and they've started to research plans or trying to access the means that they want to use, or maybe they've started to get their things in order. So, you know, starting to give things away to others, starting to say their goodbyes. Those are things that if they're telling you that they've taken it beyond the thoughts, but started to, you know, again, think about a plan or taken steps towards acting on this plan. And then that's when you know, okay, no time needs to be wasted and I need to do something about this now. And I need to help get this person connected with help. And that's where we don't want to keep any secrets. We can never promise them that we'll keep this a secret if they do disclose to us that they're having these thoughts, because, you know, this is their life could be in potential danger, and it's not the time to keep it a secret. We want to make sure that we don't promise them that we will keep it a secret. Mm-hmm. So really though, I mean, I think the big message though is it's hard for us to decide when it's imminent, right? As if you're not a mental health professional and you're not necessarily trained to make that decision or to recognize whether or not they've crossed over to where it's imminent risk. So I just say err on the side of caution. I think the best thing you can do is to help encourage them to seek help, and do not leave them alone, and say, listen, I'm here for you. I'm going to go with you to the emergency room where we can talk to someone who can talk to you more, and do a little bit further of an evaluation, and see what we need to do to help you feel better. There are ways to help you feel better. There's things that can be done. And if they, say, well, I've tried this and this and this and nothing's helped, and validate that for them, and make them, feel comfortable knowing that, yes, I understand that. But really, when it comes to feelings like this, there's a lot of different options out there, and it's just sometimes takes some time to find the right fit for you. And the right fit is not, and that answer is not the same for everybody. So let's look into this a little bit more, and let's try to see and figure out if we can figure out what that best fit is for you. I mentioned going to the emergency room. However, one other thing you can do is call 988. That's the National Suicide Prevention Lifeline. Call that line with them and say, I'm going to be here. I'm going to be even holding your hand. And we're going to talk to this person. And this person's trained to listen and to, get you connected with resources. And then that person can then decide whether or not that person needs to seek immediate medical attention or not. So again, I just caution, it's just always err on the side of caution of just calling 988. And if that person is not willing to call 988, but you're still very concerned about them, call 988 yourself. And you can tell them what you are concerned about, and they'll talk to you about it, and they'll listen, and they'll give you some advice, and they might even be able to reach out to that person themselves and further evaluate. But at least you're just making that link to get them, that potential help.
So Nicole, I know that you mentioned earlier about the some of the resources and that were out there, but I think that it bears mentioning again some of the resources or organizations that are out there to help anyone that feel that they are in crisis or thinking of suicide. Can you speak a little bit more to that again?
Yes, definitely. Like I mentioned earlier, I think the most important one we at least, walk away from this conversation knowing is the 988, which is the Suicide and Crisis Lifeline. And that was the same as what we used to refer to as the 1-800 number, 1-800-273-8255, which is still an active number and will be indefinitely. However, right now, we just recently in July have given the option 988 as well that people can use. It's just an easier way to remember. And so if you call 988, you will then be connected with a trained professional who can then talk to you a little bit more and just be there as a support, even if you just aren't necessarily having a suicidal crisis, but you feel like you really need to talk to someone and it's 2 o'clock in the morning and you don't have anybody else to talk to. Call this number. But also if you're concerned about someone and you want to call this number to talk to them about this person, and they can also then be listening and then, give you potentially some advice, or maybe even be able to reach out to that person directly to talk to them as well and further evaluate them and, and see how they're doing. And so it's a great way to get somebody connected. It's free and it's available 24 hours a day, 7 days a week. And also you have the option of calling this number, of not only calling, but also texting 988 with your phone. And then also there's a chat option that is listed on the slide. There's a link. It's the 988lifeline.org. And so you can connect with somebody through a chat option as well.
Very
I
good.
love that. I love that. There's so many different avenues for people to choose from, instead of just picking up the phone and possibly being on hold for a while. They have that text, they have the chat. So it's so just amazing. And I'm sure things will just continue to progress in ways that we can touch people who are in crisis or who are contemplating. So thank you so much for being a part of this podcast. Nicole, is there anything that you would like to share with our listeners or our viewers that you didn't get a chance to?
I just want to say thank you again to both of you for giving me this opportunity to get the word out about suicide prevention more and to recognizing the importance of it, especially this month being Suicide Prevention Month. There's a couple of other resources that are listed on the last slide. And that's just some organizations if you want to learn more about what you can do to prevent suicide. There's the Zero Suicide website. So if you just Google Zero Suicide, it'll take you to it. There's the Suicide Prevention Resource Center, which is phenomenal. It's got extra some trainings that you can take to learn more about suicide prevention. They have a really great lethal means training that you can take as well if you want to learn more about how lethal means safety and what you can do to help prevent suicide that way. And then also the American Foundation for Suicide Prevention has some wonderful resources as well as far as data and maybe even some support groups in your area if you are if you're a survivor of suicide as well. And I know this month that a lot of them are having awareness walks or events that, people coming together to in recognition of suicide prevention. So those should be listed on their site as well.
Thank you for that. And that is something that we didn't really touch on, but I'm glad that there are resources listed for people who are survivors and family members who are survivors of loved ones who have died by suicide. So thank you for including that. So this is going to conclude this episode. Thank you so much again, Nicole, for being here. And everyone, please take control of those resources. They're there for you to use. They're there for you to share with someone who you may recognize are having those warning signs. We hope that you found this valuable and be blessed.
And until next time, thank you for listening, and we'll see you next time, and stay tuned for the next episode. Thank you. Bye.
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 Bye.